What you are about to hear is going to be 75% serious talk. 20% will be two old guys going down a rabbit hole and telling stories about football and rodeo and being at least 5% funny. Please be aware that we may not be grammatically correct or even sound like we know what we are talking about, but we are trying our best to learn and cope with the cards that have been dealt to us. We believe that we can bring hope to those who suffer and help in any way that we can. This is the Head Rush Podcast with Paul Fraze and Corey Berry.
Welcome back to the Head Rush Podcast with Corey Berry and
Paul Fraze.
We'd like to welcome you back, and we're here to talk about surrounding traumatic brain injury, suspected chronic traumatic encephalopathy, repeated head impacts. We will talk about the main symptoms one can expect to have following the occurrences like mental health issues, depression, addiction, apathy, suicidal ideology, diminishing executive function, memory loss, and degenerative neurological issues. In today's episode, I'm on a suspected CTE support group, and so are you, Paul. And so I reached out and I asked Tyler Ambrose to come on. Tyler Ambrose is with Concussion Legacy Foundation. Tyler's with the peer support. Concussion Legacy Foundation was founded by Chris Nowinski, and he works with a team of physicians and professionals based out of Boston University. This group conducts research in areas of CTE, TBI, and RHI. And in my opinion, they are some of the brightest and progressive minds in the CTE research. As the peer support coordinator at CLF, Tyler's role focuses on providing resources, support, and connection opportunities for individuals navigating brain trauma and their caregivers. I personally am one of the ones involved with Tyler, and my wife is also on his support group for the caregivers. Tyler, by far, has helped me through hard times, has helped me with questions, not only during the support group, but I can call him if I'm having an issue or if I need to discuss something. And Tyler has become a main point in my life. How about you?
Absolutely, and I thank you very much for getting me involved. And in fact, I was not even on the list, and I don't know, Tyler, I don't know if I'm actually on your list yet, but I come in as Corey. No, it's
you come in as me.
Yeah, as you, because you send me the email, and I use your link to get on. But wow, it's been a fascinating time watching how Tyler actually navigates a bunch. Usually we have 15 or 16 people on there, and everybody has a different story, and sometimes more. And Tyler gets right to the heart of what every person is dealing with, and he reiterates what they're dealing with, and he supports them and encourages them and edifies them. And it's like, wow, we need this.
Well, and it keeps us in time constraints.
Right.
So let's welcome on Tyler and bring him on. Tyler, you there? Right on. How you doing today?
Doing fantastic. How about yourself, Corey?
Okay. How's that weather in California? Are you getting hit with smoke?
No, luckily some of the fires have died down. We still got a couple, but California fires, man.
Right on. Well, we just finished with our first episode of the Head Rush Podcast, and we're coming on to you. And I look at it, we got a new president, we got a new Senate, a new House, and a brand new podcast to bring awareness to CTE, suspected CTE, TBIs, and everything else. What did you study in high school? Or in college, sorry.
So, funny enough, in high school, as well as college. I studied child and adolescent development, was really interested in the development of children and how they grew and behaved over a period of time. I used to work with individuals who had disabilities in the school district and in homes, primarily autism and other behavioral challenges. But once I finished my degree in child and adolescent development, I got out into the world of trying to help people, and that's when I found Concussion Legacy Foundation.
And how'd you come about joining CLF and the support programs? And what kind of training did you need to deal with people like me that are all messed up?
I wouldn't quite put it all messed up, but looking for some support is definitely the way to go for there. Just happenstance and luck, I would say. I was applying to jobs looking for the right one, and I would say Concussion Legacy Foundation was a job application out of about 20 that I put out there, and started going through the interview processes of a couple jobs. And first interview with CLF was a Sam Bureau, and incredibly sweet person, super knowledgeable, and made me really excited to go through the next interview process. Met with Michael Burke, patient services director, and from there I saw that it wasn't just Sam that had passion, it was Mike as well. Not just for the position itself, but for helping people and learning more about TBIs and what they can do to support those who are struggling. And throughout the interview process, met more of the team, met Julian Manning, met Chris Nowinski. I felt absolutely in love with the job. It was all I could talk about with my family. I started doing research into concussions and TBIs, taking Coursera trainings, just trying to increase my knowledge of brain injuries. And once I got, an offered position, jumped on it, started working with the company within a week, and started doing some facilitator training, dealing with crisis situations, dealing with, groups going a little bit chaotic at times, or people going through some emotional stress. And it's something that's entirely difficult for people to deal with on their own. So happy enough that I'm able to be in the position to help people kind of process through some of their emotions and some of their difficulties.
So Tyler, this disease state is an invisible disease state. And I think it actually makes the patient group an invisible patient group. Then there's not a lot of help. There's not many support groups. There's not a lot of help out there for people who are dealing with repetitive head impacts, possible CTE. You have a very important. You have a gift, and you have a very important job. What would you say a podcast like this should do, could do, and how do we do it? What would you give guidance for us to raise awareness and get this word out there? Because again, support groups like what you're doing at CLF and they're vitally important to the well-being of people dealing with these disease states.
It's a great question, Paul. And I think one of the main things we can do is just to create awareness that these things do exist, that suspected CTE is real, and, repetitive head injury and persistent post-concussion symptoms. And to so many people out there, it is an invisible illness. You look at people who are going through these symptoms, and on the basis of just their looks, they look fine. They look like normal, everyday people that are just walking down the street. And inside, they're dealing with a turmoil that's really difficult to understand unless you sit there and talk to them and listen to their difficulties and listen to how they're struggling. And so being able to openly talk about it without, fear of being a, diminished person or lessened value of can be a really big benefit. And just kind of listening to what the life journey that they're trying to navigate, because it's not an easy one, and it is really hard to understand from an outside perspective unless you've kind of dealt with it, which is why so many people that come into our support groups say that they feel isolated or alone, or that nobody understands them, even if they do try to talk to their families. So creating that openness and that open-mindedness of being able to learn more about CTE and PPCS can definitely help a lot of people out there.
How do you find, now, I've heard you say you've had thousands of calls other than the support groups that you run. You know, I think you have 4 or 5 support groups every week. Am I thinking straight on that? Or three
So
or four?
Yeah, we have a persistent post-concussion symptoms support group, a suspected CTE caregiver support group, a suspected CTE patient support group. We have a group for impacts of brain trauma on families, and then we even have a concussed moms group as well for moms who are going through a concussion and trying to figure that out as well. So those groups are amazing, and we're ever expanding. We also have our Canadian counterparts who host a lot of different groups, including an amazing veterans group as well that has just recently started. So we're definitely expanding in all of the areas we possibly can.
Do you see the concussed moms group? Do you see sometimes domestic violence coming into play?
In the a concussed moms group, it's more of mothers who sustained a concussion and are trying to figure out how to still be that mom, live through that motherhood, because it is a difficult experience to do, let alone with a concussion and all the symptoms that come along. And Allison Moore Smith, our group facilitator for that group, is an absolutely amazing person who has gone through it herself and really helps these women navigate the journey that they're going through. Some of our other groups, such as our suspected CTE caregivers group, we have had some people come through stating that they have felt some domestic violence at home and, have been worried. So CLF has a lot of procedures in place to get resources out to them. You can call them wellness checks or send them resources and information that could benefit them and put them into a safe environment. So we always push for safety and wellness over everything.
So I know firsthand the importance of a support group. I mean, I've been going for a few months now, Tyler, or half a year or however long, I don't know. I know the importance of it for me. Plus, if I'm having issues, I got a direct line right to you, even unaware from the support group. And my wife is part of your suspected CTE support group for caregivers. And I don't get involved in that at all. That's her deal. I don't want to be involved. That's her avenue to talk about and to get help and everything. But from when I first signed on to what I am now and how I'm able to better, I put a lot of that with talking with other suspected who I've connected through Concussion Legacy Foundation and have gotten their personal phone numbers, and they're on my direct dial. So what would you put on the importance of a support group? I mean, what have you seen in me? What have you seen in others? What keeps this so real and so driving to you?
I would say anything over anything it's going to be camaraderie. And I know that having suspected CTE can be such an isolating experience, and that's just from the wisdom that so many people have come through the group or come through the helpline have really established, is that they feel alone. And it's so hard to talk to people about the difficulties of dealing with such volatile emotions and not being able to really talk to people who don't understand what you're going through. And so often I see in the group is that when someone's sharing what they're navigating and what they're going through, you'll see a bunch of people nodding their heads, agreeing, putting thumbs up. And you just see that you truly have other people who understand what you're going through. And suddenly it doesn't feel so isolating. And that when other people are like, I went through that too, and I did this, and it helped me here, and you see people light up, and like a sense of hope is just established there of like, wow, like I thought I was just going to deal with this, and then that was my life, but there's other things that I can do to kind of help me navigate this. So I think the support groups really provide camaraderie and showing that people can come together, even if they're both having a difficulty, that they can come together and come out stronger on the other side.
I want to go back to, you were talking about numbers, and so outside of the thousands that are in the seats, and witnessing and being a part of the support groups, how many calls, sorry about that, many calls have you dealt with over 2024? Is it thousands? Is it 7,000? Is it 10,000? How many people are reaching out to you?
So CLF has a helpline form. It's called the CLF helpline, and you can fill it out to get access to providers, resources, information, even linking us over to peer support, finding the peer support groups in the one-to-one connection program that we have. And last year in 2024, we had over 1,400 people fill out this form looking for support. I think it puts us at a cumulative since we started in 2019 of above 7,000 people that we've serviced and helped and spoken to. And we have amazing helpline coordinators and a manager. The team is absolutely amazing. Everyone that speaks to them feels better off afterwards, feeling like they're finally heard and that they have a possibility of finding a chance at recovering from their concussions or TBIs, or even finding resources or doctors or neurologists that they've been looking for a long time that they didn't know even existed. And so the helpline is just a great option for people to really come through CLF and seek help. And that often pushes a lot of people into the peer support, so that way we can further help them by offering them people who understand what they're going through.
Are we allowed to put that helpline on our podcast and give the people that information?
Oh, absolutely. Yeah, would love to hear the helpline be everywhere. If the helpline could be on buses and maybe even on the moon one day, whatever it's going to be to help people get access to some help, or being able to donate their brain, just as that shirt says. So love the shirt, Corey.
You can even take a picture of this right here.
And hook up with CLF.
And hook up with CLF.
Their support groups. Wow, this is a podcast about hope. It's about awareness, and it's about giving people avenues to, this particular episode is a great avenue to give people a voice. And like I said earlier, I hear a share, and I hear you repeat that share to them and tell them how important it is. And I've shared, and you've said, hey, that was so important that you shared that. Other people are experiencing that. Corey has mentioned that just having somebody to talk to you. You have a bunch of phone numbers of members of the support group, and you call. If I don't answer the phone, you call the next one down the line.
Oh yeah.
I'm assuming that you might call me once in a while. Maybe I'm wrong, but no.
I talk to you more than I talk to my wife.
Well,
but I mean, you look at it. Me and Tyler were talking earlier. In 2014, they've had 215 registered for the suspected CTE groups. They've had 1,337 people that have reached out to them. I mean, on the helpline request, 1,492. I mean, that's a lot of people. I mean, 215, we talked to 15, and that's just one group. And now you look at the military support group. And Tyler, there's one we were talking about it last week or the week before. Harvard person is leading the support group, and you really wanted to talk about that. What support group is that?
It's going to be the impacts of brain trauma on families. And it's led by Tammy McLeod, a Harvard grief counselor. And she imposes onto the group the curriculum of ambiguous loss, which isn't the death of a loved one or isn't the loss of a loved one to death, but their personality or behavior or cognitive changes are so severe that it feels like they're a different person. And often a lot of our caregivers feel that through the journey of suspected CTE, that's exactly what they've lost, is the person that they had before. And it's not always the case, but some of those more severe circumstances, or when symptoms are left untreated, these caregivers kind of delve into that that navigation of that journey of trying to figure out, who is this person and how do I help them? And so to deal with that grief, Tammy, hosts that support group, and she's an amazingly sweet woman who's had to deal with something similar in her own life and understands the personal struggles and that it can bring on to an entire family. And so she houses that group, and it's going amazing. We've heard great things about it, and so we're very happy to keep that running, and very, very thankful to Tammy.
I think my wife is a member of that group, plus yours also. I mean, I hate to bring up the topic because that's rough on me. I mean, my wife's on an ambiguous loss. This is a tough disease, and, the participants are benefiting, I believe.
Absolutely.
I really do. Welcome to the Head Rush Podcast, brought to you by the Patrick Risha CTE Awareness Foundation. Karen Siegel, thank you so much. Paul?
So go to stopcte.org, learn about their foundation, and they are sponsoring us for the next year. We are thrilled to have them team up with them and bring awareness to this disease.
So please go to their Facebook page, go to their website, check them out. Karen is very, very, very willing to work with you. Contact her, and if you do know her, thank her for us, or just go on their Facebook page and say thank you for sponsoring the Head Rush Podcast. Tyler, what avenues, what venues are available? I mean, what can CLF do for people? What are the benefiting and supports other than just the support groups? I know the helpline helps you with doctors. It helps you get the help you needed. They got a list from all over. I got to go see Jeremy Tanner, which we discussed in the first episode, but Boston University sent me there because of my condition and my background. And Tyler, I opened up and I showed him my CTE evaluation. And I believe that was the first one you've ever seen. And to look at that, tell me a little bit about what you thought about when you were looking at my medical, and then also talk about the avenues and what all people can go to see and get help. Because, I just teared up a little bit and I'm wanting to take a little break, and you and Paul can talk. It's just open up a little bit about you reading my evaluation center medical record that I shared with you, and then you and Paul can talk about some of what all the helpline can give you.
I think it's a generous question there, Corey, and I'm sorry that, it's difficult emotions to deal with, especially when it comes to family and your loved ones, and not feeling like you're that same person or that you're failing them. Because I know that you're not, and I want to put that out there, man. So you're doing an amazing job, even putting this out there, and everything that you do for your family. You should be very proud of yourself. So do want to put that out there as a first thing. And as for other avenues for CLF, we do partner with BU, and brain donations are always a welcoming sight for all of us, because the more that we can get, the more research we can do into figuring out how to identify CTE before someone is post-mortem and having to study their brain, so that way we could possibly help. And I know we've got blood tests going on to see if we can detect it in the blood, but those studies are still ongoing. We are striving for it. One of the great things that CLF does is that we'll host CMEs, continuing medical education. And it's just increasing knowledge on suspected CTE, TBIs, brain injuries, PCS. And we'll have speakers on there, and we'll have doctors attend for, credits as well. And just kind of spreading the information so that more and more providers are aware of how TBIs affect people and what good treatment methods are available, and how people can cope with such symptoms using medication or different therapies or even alternative therapies. And so these continuing medical education is a fantastic way that CLF is trying to push out more knowledge into the communities so that they can further be able to be supported and helped during their time of, crisis or struggling.
you talk about the team at BU, and I personally met with
And McKee.
well, I met Ann McKee this summer, last July. I was like a kid in a candy store. Ann McKee, I finally met her, and that was a thrill. But Bob Stern, I sat down with him 10 years ago when I was first in a clinical trial study, trying to find biomarkers for CTE, and wow, what a caring group. And I really remember his concern for the player, for the sports enthusiast, for the person dealing with suspected trauma, definitely trauma, brain trauma, and suspected CTE. I actually he was on a symposium last year. And I've sent out his talk about caregivers. He's got like his top 3 or his top 10 list for caregivers.
The don'ts.
Yeah, the don'ts. Yeah, and wow, I mean, maybe we can share that. It's public knowledge. Maybe we'll share that. In this podcast, we'll get the what is the technology, the website or whatever, the link. Thank you, the link. So one thing that I find fascinating when you on the helpline that I've been involved with, a lot of people are very knowledgeable, scientifically as knowledgeable, and they come up with possible therapies, or what do you do when a participant mentions a new therapy or a supplement or a technology that has promise, that has worked for a participant? I know there's certain rules of the support group, but how do you handle that?
So if it's within the support group, this is a peer-to-peer group. We let people share openly because we want to give any alternative possibility for anyone that comes across. And so it is open sharing. And, as CLF, we don't endorse things. We don't promote things. We just, if someone mentions something, I might go and find a link for the group. And, one of the main things I always say in our support groups is that to do your own research. Whatever you find, always look into it, talk to a medical professional, because that's not what we offer in those kinds of groups. We don't offer professional advice or legal advice or medical advice. And so whenever you're looking into a new therapy or a new study or a new medicine, it's always important to do your own research first so you can be aware of what the side effects are, what the causes, what it can do, what it can't do, and how it can be beneficial. And so whenever anybody ever puts something in the support groups, if it's something that we can ever put in our helpline, I might nab it, bring it back to the team, see if it's a possible resource we can send out to other people. But it's overall a team effort to see what resources we can always provide. But we always look to the higher end professionals that, know more and have more knowledge on these information or these resources that people are posting before we ever endorse or promote anything ourselves.
There's 2 don'ts I know of I can remind off of the support group that Tyler will actually kick you off the support group.
But he's never kicked anybody off, I don't think.
No, you never have. But you don't share dosage
of
your meds, and you do not give out your personal info.
Right.
You don't share it. You can go to, and I believe you got CTE resources on Facebook. You got your regular Concussion Legacy Foundation Facebook page. And get to that CTE resources. There's also a private chat on there. If you got questions or anything, you could go on there. I mean, there's so much out there that Concussion Legacy has done in CLF to promote.
So Corey, are you better off for finding CLF and their support groups?
1,000%.
So you would say, on a podcast about hope, you would say that you've been given encouragement and hope through a support group like what CLF has.
Oh, yeah. There's members on our support group that I think I'm middle of the road, maybe advanced more than some. Well, I'm advanced more than quite a few. But there's some that's a little bit more, I think. But the great thing about it is we get on there with Tyler and we share our stories, and they say, well, I'm trying this and I'm trying this and I'm doing this, or, talking about suicide, talking about our deepest, darkest areas. I mean, we can go dark, but you know what? We always end the support group on a positive note.
Right.
And I think being able to talk to my peers, because us cowboys, we don't talk about problems. I don't know about you, but you guys are whiners. You get turf toe when you go to the corner. But oh my God, I hurt my pinky. I gotta go.
I've known a personal friend that cut half his pinky off and played in the game. And you know that story. Anyway, go ahead.
But I'm just saying, so it's great that I found a place that I can be open and talk to about it, and that helped me with this podcast. I mean, Tyler, some of the avenues, what all is there? There's resources, there's the helpline. What else? I mean, what all's available?
So from a peer support standpoint, we have the Facebook groups, the PCS resources and the CTE resources. We have our 5 facilitated groups on the US side for support groups on Zoom. And then we have a one-to-one program as well. And we're looking to expand it. Right now it's covering PCS patients, PCS caregivers, and suspected CTE caregivers. We're looking to expand it out into CTE patients as well. But those are the resources from peer support. On the helpline, we're offering providers resources information. That's kind of where we delve into for patient services, just trying to offer as much as we can. But overall, the thing we try to offer the most is support, empathy, and hope. And as long as we can help one person find hope at a time, that's something that brightens our day. Even if we do have difficult discussions such as suicide in the groups and they get dark, it's important for people such as yourself to be able to vocalize that. And it's hard coming from a culture of not being able to express your emotions or express your feelings when you're feeling afraid of something, or you're feeling scared about something, or when something is fearful and driving you into a corner. Having people to really discuss that with, that truly understand where you're coming from, even if it is a dark place, can actually bring you a lot of hope, as in, hey, maybe this isn't my only alternative. Maybe there are people that understand me that I can communicate with, and we can figure out a path together.
When you're talking about something as serious as suicide ideology, we most of us, if not all of us, have known somebody who has taken their own lives. And we say, after it happens, we say, if we had only reached out, if we had only, talked more to them, if we had only done this or that. But I think, we can never blame ourselves for a certain instance like that. But when you hear exactly what you just said, just the empathy, the communication, the saying it's okay to feel that way, but you can't stay here. There's ways out. There's a better way. There's a different way, and I think, wow, these, you can't say enough about. You're talking about, cowboys never talk. Well, men never talk. They don't want to. They don't want to talk. They.
How are you? Fine.
Yeah, fine. I'm fine.
Do you really want to know? How many guys have said, how are you feeling today? Fine. No, I really want to know how you're feeling. You never hear a guy say that. Never. I'm okay. I'm not going to sit there and go, no, I want to know your deepest, darkest secrets.
Well, it definitely. One of the things too is, I'm not just saying this because we were talking about men, but the women on the support group too have offered so much insight and some things that they go through, and maybe they're teaching us to communicate a little more. I don't know, but I just find that fascinating. If we open our mouths and eyes, we're probably going to ignore the first thought and maybe pay attention more to the second thought. And what, in your opinion, and I'm not asking you what the science is, but I'm asking you, what does the future look like from your perspective, in CLF's perspective? In your opinion, is the science advancing? And I know in terms of like Alzheimer's, they started taking a blood test, and I don't know if it's nanotechnology or just, but I think that BU is doing a study. What's the blood draw study, or Tyler already mentioned? The
bankcte.org.
bankcte.org. How specifically does CLF see that can help with the advancement of the research?
I can't speak personally to the advancements of the research. I don't have that medical background, but from, what the team has shared and what CLF has shared is that, our hopes are that if we're able to diagnose suspected CTE through blood, we can incorporate the proper therapies and coping mechanisms to kind of slow down the process of those degradation of tau proteins by, such things as cognitive behavioral therapy, or, speaking to a neurologist about how you can be more aware of hitting your head can cause further damage. But when you see the progression of, stages 1 through 4, and it gets worse, if we can, diagnose at stage 1, there's coping mechanisms and ways that if you cope with the symptoms well enough that, things could progress for a very fruitful life. And I can't say that there's going to be a cure for it. I wouldn't know that knowledge or how to even get there, but hopefully one day, that's the hope, is finding a cure for CTE. And, as our mission statement always says, we're looking to help those who are struggling through a concussion or TBI or CTE. And, that's what we're here for. So at any point in time, if anyone's ever in need, they can reach out and we'll be there to support them with compassion, empathy, and, definitely value the courage that they have to reach out. Because it's not easy to seek out support. And a lot of times people just want to do things on their own and figure them out. And especially you tough guys in football and Cowboys, trying to handle everything on your own and put the world on your shoulders and not talk about your emotions. And, sometimes being able to open up to a group of people that can understand that, it's a very valuable thing. So I'd love to improve on that culture of openness and communication between people who may not feel like they can have their voices heard. Just as Cora was saying, like, when do you ever get to hear that, I want to hear about how you're doing, not just fine. And that's what you'll hear in the support groups, is that, you're coming to us is you're not just fine, you're struggling. And we're here with the compassion and open-mindedness, and we're here to support you in any way that we possibly can. And just know that it's a safe place, it's confidential, and it's a judgment-free zone. So whatever you're going through, whether it's something that sounds terrible out loud, but you need to say it so that way other people can understand it, that's a place that we want to create, so that way you feel welcome enough to be who you are and be yourself and figure out how to navigate all the challenges that you're going through.
Now, I got a question that just popped into my head, so I apologize. Providers, is there a place that doctors can go to, or therapists, or counselors? Does CLF have anything to do to help educate them? Or is there a link?
Yeah, so I think we touched on that previously. The CME is the continuing medical education, where they can, attend our CMEs, get credits, but it just creates that awareness, that knowledge of suspected CTE or TBIs or concussions and PCS and everything that comes along with it. So that's just a place where providers, therapists can come to be more knowledgeable in those areas.
got the link to that, or is there a phone number or something in case that there's a
Yeah.
provider out there that wants it?
So I can definitely get you that.
That would be wonderful. I'm sorry to put you on the spot. I wasn't going for the scientific advancement, but I was just, you answered it perfectly, and I appreciate that. We always, so first of all, we definitely want to get any and all of the links that we need from CLF, and we'll definitely be putting everything up on the podcast. We like to wrap things up by giving a positive action step. We want to give hope, right? And that's what the reason for this podcast is. Do you have some advice that you would share with us and to give people hope or an action step?
Absolutely. When it comes down to it, I say it's okay to ask for help. It's okay to not be okay. And I think it's something that a lot of people struggle with, is that they feel since they're not okay, that things in life aren't okay, that their life isn't going to go in an okay way or even a great way. And no matter how much people struggle, there's going to be times when things are going to be better and things are going to be good, and you can always get to that place. And reaching out for support, finding a good support network, asking people for help, and seeking out that help can be a really big benefit. And it's what our groups hope to do, is to build hope. And I know we've built a community. I know we've built a lot of success with people progressing in a way that they're more successful now than they were when they first joined the groups. And, it's what we want to keep doing. So always feel free to reach out. And I would say that, it's never going to be a bother to anyone. It's never going to be something that's going to bug someone or be a detriment to them. You reaching out and you getting help is what's going to be the best case for you and everyone around you. And so if you ever need that help, I will be there. CLF will be there. I know Corey and Paul will be there. There are people out there that care about you, people that want to help you, and people that want to support you. So have hope, reach for hope, and we'll be there.
And a great thing, just to quick end on hope, is I got this shirt from Concussion Legacy Foundation. It says, I pledged my brain to end CTE. And we were down in Port Aransas, and the wife wanted to go out, and I was trying to figure out, because I get overstimulated around people, and I can't be around loud noises and a lot, and my brain will fry, and I'll get mad. And it was great awareness that people actually knew what CTE were. We actually ran into one person because I was trying to go fishing, but I can't go on a chartered boat because too many people.
Right.
So we were looking for a private fisherman. And we ran into this one gal, and she actually worked with Jeremy Tanner at UT Health San Antonio at the Glenn Briggs Institute. And it was just awesome that, just a shirt like this helped me get through the day. Helped me to where people read that and they were like, okay. It was just something simple as this helped out. And I got to say, hope is all we have, and I'll say it at every episode. CTE, suspected CTE, is not a death sentence. You are not going to die. And if you think you may have it, go out and get help. Find it. I do vestibular rehab. I got speech rehab. I got a therapist I talk to once a week. I got a support group I'm on. I got you. I got my wife. I got a collection of phone calls. I got doctors. And hope is all that I have. And as long as I got a breath in my body, blood thrown through my veins, I got hope. I'm not hoping until I'm dead. And like StopCTE.org, Patrick Risha CTE Awareness Foundation, Karen lost her son to suicide. Horrible. I've lost friends of mine that have died and killed themselves. Did they have CTE? I don't know. They didn't send their brain off. I donated my brain to Boston. Mine's going there for Ann McKee. But the hope is so important in this, and there's so much out there that can help you. I mean, you don't have to be a man. You don't have to just consume it all and think, I got this, I can work through this, or take that drink, or do that drug, or do anything to make you feel better. There's help out there. Go and find it. Tyler's a great asset, and I recommend anybody that thinks that they may be suspect CTE to go on the CLF helpline, register, get put down, or if you're suffering from a concussion, for post-concussion syndrome, or domestic violence, or anything, Concussion Legacy Foundation can help. And there's just so much hope out there.
Absolutely.
I just want to say that.
Absolutely. Tyler, give us one more plug for the Race to End CTE. Did I say that correctly? It starts in March, or is it the CLF? That's their program that starts in March, right?
Right. Race to End CTE. The Head Rush podcast is joining it. We are going to join it, Tyler. We're going to bring lots.
As long as we don't have to run.
I ain't running nowhere. We'll let Tyler run for us. How's that? Ladies and gentlemen, welcome to Paradise Behavioral Health in Punta Gorda, Florida. Dr. DeMayo is sponsoring this episode of Head Rush. And she deals with...
She's a doctor of psychiatry, and she has the Paradise Behavioral Health and the Brain Well program, and which we're both on. So we're very excited to have Dr. Mizell DeMayo as a sponsor for the next 10 or 11 months, right?
Right.
So it's awesome to have them on board, and thank you very much. And definitely go to their website, learn about what they do, learn about they call it precision psychiatry, and she's right for anything that ails you. So go check them out on the web, Paradise Behavioral Health. And look for the Brainwell program.
And she also deals with the Millennium Health Protocol and the hormones that me and Paul both are part of. So go check them out. Thank you, Mizell. You're awesome.
So, Race to NCT, it's going to be from March 1st to May 30th, and all are welcome to participate in it. And the best part is you don't have to run. So plenty of people will do the running for you. You can walk the whole thing. Some people, do miles. Some people do 8 miles. Some people do less. But the main focus is just that we're creating awareness for suspected CTE, and trying to really show that we're going to be there for those who are struggling and doing whatever we can. So as long as we can create a little bit of awareness and support someone out there who is struggling, CLF will be happy.
So we can walk. That's a given, right? We can raise money by just walking and raise awareness. Thank you.
You don't even have to walk.
We don't really. Okay. We just say we walked. No.
No.
Well, we got to thank Tyler Ambrose. Tyler is the peer support coordinator for the Concussion Legacy Foundation. We benefit directly from the programs for CLF that Tyler runs. Thank you very much, Tyler. We got to thank our sponsor, the Patrick Risha Stop CTE Awareness Foundation. StopCTE.org, right?
Right.
StopCTE.org. Karen Ziegel, and that team. They're a great support. Thank you so much. Thank you, Tyler. And I will see you at this next support group.
When is that, Tyler? Are we next week?
We are, yeah. So the fourth Tuesday of every month at 7 p.m. Eastern time. Then we also host the second Wednesday at 1 p.m. Eastern Time. All are welcome. Fill out registration, and we'll get you in the group, get you some support. But looking forward to it.
Now, is there a criteria to join the suspectedcte.org versus concussion, or what? Is there a criteria? Is there anything you have to meet, or what?
So our PCS patients registration is open. We understand that people might be coming from lots of different backgrounds, lots of different exposure for concussions and TBIs, and so want to be able to offer them support. I would say that one of the best qualities of our support programs is that participation is entirely voluntary. And the way that that works is that people jump on Zoom. They're welcome to keep their camera on or off. They're welcome to keep their microphone on or off. It's entirely up to them. We use an open sharing format. People are allowed to share anything that they want to. We have a raised hand function, so people take turns, so it's not super chaotic. And we also employ a timer, so that way people are aware of how much time that they're speaking or sharing, and that can be aware that other people might want to share or respond to their share as well. And, sometimes people go over that time, and it's okay, just a small reminder of that. Sometimes we get lost in our words or lost in our share of our story, and that's totally okay. It's the perfect place to be able to do so. As for the suspected CTE patients group, we do have more registration questions, such as if you're working with a knowledgeable provider, and that's okay if you're not. It's just for our knowledge to see if we can provide resources in that group that could help, such as the helpline to find a knowledgeable provider. If you have repetitive head injuries, we just want to make sure that the group is for those who kind of fit that category, so that they feel welcome when they join into the group. And when people register and they see those questions, if they feel like they relate to those questions and want to join, they're more than welcome to, and I see those all the time on our registrants list, and anything that we can do to possibly support those who are struggling.
Thank you so much, Tyler. Yeah, I just wanted to say you don't need to go get all the medical that I've done and
Just to be a participant.
just to participate. That you can do it a lot easier.
Right.
And so if you feel like you need help, contact Concussion Legacy Foundation and reach out to their helpline. All the info is going to be down here. Any providers, you can reach out to the helpline also. You can get CME credits. And so just give hope. Paul, what's your stance on hope for this episode? Give the one last thing of hope.
Oh, gosh.
I'm putting you down.
Well, there's been so many things that have been,
Fourth quarter.
have been said.
Down.
Yeah, I'll score the touchdown, yeah. Should I go back to Dostoevsky? No. Hope really, hope, you know what? We truly believe that awareness leads to hope, hope leads to actions, and finally, hope leads to positive results. So go with hope. CTE is not a death sentence, and there are therapies, there are modalities, and there are things to do to relieve the pain. So go with hope. Thank you, and stay
alert, stay alive.
Thank you, Tyler.
Thank you, Tyler. Appreciate it. You have a good one.
You too.
See you next week.
Will do.
That was a great episode, Paul. I really enjoyed having a support person on to help show the awareness to this.
No, we got an extra hour of therapy. So we just saved 120. No, it's a free therapy.
Right. I was going to say, God, I hope they're not charging. I can't afford it. But, I mean, to go from being with Mizelle DeMeo and Dr. Gordon, showing the medical side of things on the progressive side and talking about all of that, to showing a support group and where else you can go to get hope and help,
right,
I think is tremendous. And I'm really excited to join the End to Raise CTE Awareness. It's to raise funds that goes to
CTE awareness, and they do research. They
Right.
do a bunch of research.
with Boston University, where my brain's going, your brain's going to
Yes.
Boston.
Yeah.
And so I just want to just say that's a tremendous.
Well, this episode, shows how vitally important support is, and support can be as simple as you and I chatting on the phone for 10 minutes, and if you're not available, I'll go down the Rolodex, and that's what this support offers to people. This is not a hopeless situation. This is a situation that there's therapies, there's modalities, there's things to do, there's people to talk to, there's support groups out there. And you said, nobody really dies of CTE unless they choose to, succumb to. But anyway, we don't want to talk
not
about
gonna
that.
end
No,
on
we're
that.
not going to end that. We're gonna end
It
on
takes a village,
It takes a village,
and
absolutely.
sometimes a city, and sometimes a state,
And-
but it takes a village, and there's a lot of people out there that have the village.
Amen.
And so hope and awareness is everything, and I will not leave on a note of that.
I'm glad you were here to give me support. Thank
We're
you
going
all.
to end on hope. Thank you so much. And like I said, if you need help, reach out. We have a Facebook page, the Head Rush Facebook page, the Head Rush Podcast with Paul Fraser and Corey Berry.
Right.
We have a Facebook page. We also have YouTube channel, Head Rush Podcast with Paul Fraser and Corey Berry.
Make sure to do all that liking thing and sign up and
Sharing and-
subscribe and share and all that stuff. You'll have that opportunity.
What did them
You-
famous podcasters say? Click the button below.
Thank you all.
Thank you. Bye.
This podcast is for general information only and does not constitute the practice of medicine. The use of this information and the materials linked to this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard and delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.